Intense pain, rigid joints, and significantly limited mobility, these severe symptoms are a daily reality for millions of individuals. Joint conditions like osteoarthritis and arthritis rank among the most prevalent chronic diseases. In the United States, it's estimated that over 32.5 million adults live with osteoarthritis, and up to 1.3 million with inflammatory forms of arthritis. Globally, it's estimated that over 350 million people are affected. These figures underscore the widespread impact of these conditions and the importance of continued research and treatment development. However, even though these diseases are so widespread, they are often still unrecognized or mistakenly dismissed as normal signs of aging. For a long time, osteoarthritis in particular was considered unavoidable if you got old enough. The massive consequences such as chronic pain, restricted mobility, and the slow destruction of the joints can have an extremely negative impact on the quality of life. But what exactly is behind these different but equally tormenting illnesses? How can they be recognized, treated, and in the best case, even avoided? In the next few minutes, we will look at osteoarthritis and arthritis from different perspectives. Using well-founded information and expert opinions, we go into detail about the causes, characteristic symptoms, and the most important treatment options. Find out in an understandable way how you can protect your joints in the best possible way, effectively alleviate the often massive symptoms, and significantly improve your quality of life, despite these widespread chronic diseases. Osteoarthritis marks the progressive wear and tear of joint cartilage, which is essential for smooth movement. Over time, this cartilage loses quality, which can lead to pain and restricted movement. Common causes are mechanical overload, for example due to heavy work or being overweight, as well as joint injuries or misalignments. Metabolic diseases can also damage cartilage. Interestingly, cartilage cells are not supplied directly by blood, but by the movement of the synovial fluid. Therefore, lack of exercise or inadequate nutrient intake can affect cartilage health. Regular, moderate exercise is crucial to supply the cartilage cells with nutrients. Without it, the cells begin to degenerate, the cartilage breaks down, and ultimately the bones rub directly against each other. As soon as the protective cartilage coating is severely worn down, there is increased friction between the bones on one another. This leads to stabbing or boring pain in the affected joints, accompanied by increasing stiffness and restricted movement. The large, stressed joints such as knees, hips, and finger joints are particularly affected. In contrast, there are inflammatory joint diseases such as arthritis, in which the immune system mistakenly attacks the joint cartilage. The causes are varied. Rheumatoid arthritis, the most common form, is an autoimmune disease in which the immune system perceives its own joints as foreign and attacks it. In gouty arthritis, crystalline uric acid deposits in the joints cause inflammatory reactions. The consequences of untreated osteoarthritis and arthritis can be painful swelling, redness, and overheating of the affected joints. Over time, these diseases can lead to significant damage to the cartilage, in the worst case leading to complete destruction and stiffening of the joints. Therefore, prevention is crucial. A balanced diet rich in anti-inflammatory foods such as fruits, vegetables, and high-quality oils can protect joints. Regular joint-friendly activities such as swimming, cycling, or Nordic walking strengthen the muscles and thus promote joint stability. Being overweight significantly increases the strain on the joints and should therefore be consistently reduced. Smoking and excessive alcohol consumption promote inflammatory processes and should be avoided. Appropriate treatment after joint injuries and overuse is equally important in order to avoid permanent damage. Unfortunately, once osteoarthritis occurs, there is no complete cure. Nevertheless, there are a variety of approaches to slowing down the progression of the disease and alleviating the symptoms. Physiotherapy, which includes special exercises to strengthen the muscles and protect the joints, plays an essential role. On the medication level, painkillers, cortisone, and specific anti-inflammatory rheumatism medications are available. Aids such as walking aids and orthoses, as well as weight loss, can also help minimize the strain on the joints. If the damage is severe, an artificial joint replacement, such as a new hip or knee joint, may be necessary. A lot promising, although still relatively new, approach is treatment with cannabis products and isolated ingredients such as cannabidiol, CBD, or the psychoactive ingredient tetrahydrocannabinol, THC. Preclinical studies on cell cultures and animal models as well as initial patient reports suggest that these cannabinoids could have several positive effects on joint diseases. Thanks to their anti-inflammatory and pain-relieving properties, they seem to alleviate the main symptoms such as pain, swelling, and inflammatory reactions. In addition, there is evidence that cannabinoids can improve joint function itself by slowing the breakdown of cartilage and maintaining joint mobility. The active ingredients of the cannabis plant appear to be effective in several places in the joint. They inhibit important messenger substances in the inflammatory reaction, modulate the activity of immune cells, and interact with receptors that are responsible for the formation and breakdown of cartilage. Further clinical trials are still needed to fully explore the full therapeutic potential of cannabis-based therapies for osteoarthritis and arthritis. However, for some patients, they may be a helpful addition to traditional treatment options. Osteoarthritis and arthritis undoubtedly represent significant challenges in many people's everyday lives. However, the positive message is that there are a variety of ways to effectively combat these chronic joint diseases and significantly increase the quality of life, be it through targeted relief of the symptoms. It is crucial not to give up, but to take action and seek professional support. Through consistent treatment, which includes special stretching and mobility exercises, physiotherapy, medication, and other appropriate measures, the symptoms can be well controlled for most of those affected. An open dialogue with doctors and therapists is the key to finding an individually tailored treatment plan. Essentially, the challenge is not to simply accept chronic joint pain and limited mobility. Instead, we should use all available resources to counteract them. If the distressing symptoms are successfully controlled, enjoyment of everyday activities can be more easily maintained or even regained. As always, we hope everyone lives a long, healthy, and happy life. See you next time.